tell you guys in the beginning, before you come in, just take a slow, deep breath, breathe out, count 3, 5, 10, and then go ahead and come in. You'll want to make sure that you'll come in, you'll draw your stick. This particular time, I've drawn an abdomen. So then I will explain to the patient that I'm going to perform an abdominal exam on you today. My instructors are here to observe as well. What I'll take a look at is at first I'll just clearly inspect, and then at that particular time I'll place my stethoscope onto your stomach, and I'll listen all throughout your belly. You may feel like I'm listening in an area for a long time. If that's the case, it may mean that your vowel sounds are not abnormal. They're just a little bit slower than one would typically see. And then from there, I will tap on your stomach in a very specific pattern, and then from there, I'll lightly press, and you'll need to let me know if I need to press as well. At this particular time, I would also make sure that you would identify that you will make sure that you are asking the patients if they have any specific history that would indicate that you should not palpate their abdomen or press hard from there. So I would make sure that you note that if you're talking to either Bill or I in your assessment. So I would ask that you would lay back for me.
I think also maybe they should even ask if the patient has a history of any pain, in the abdomen. Is there any? Just in case, I mean, we don't always know their history.
Right.
Sometimes we do. Is that mandatory, or what do you think?
No, I think any conversation or communication you have with the patient is always positive.
Especially when it has to do with pain.
You will always want to provide them, I'm going to lift your legs up here, the most amount of privacy as possible. So because this is an abdominal exam, you'll want to bring the sheet up to at least their waist area and then pull their gown up instead of coming right in and going for ripping.
No rip-offs.
So the first thing we'll do here is inspect his abdomen. Right now what we're noting is we're looking for color consistency, distribution of hair throughout. We're looking for any bulges, masses, any pulsations. We're also looking across the skin for any lesions, any moles, any nevi that you've noted as well. If you do note a couple of moles here, what you'll want to look for is the size. Is it raised? The distribution. You also want to look and make sure that it's rounded and well approximated throughout there. During this time is a good time to just kind of do your general survey and evaluate him for his level of consciousness. Note if he's anxious. Note if there's any facial grimaces as well. During our conversation would be a good time for me to ask him things such as to confirm his name. Can you tell me where you are?
Yeah, the capital university.
Were you unsure? Were you like, where are you at?
Yeah, Am I in the hospital? I don't know.
Do you know what season it is or what time of day it is?
That's all midday.
Okay. So those are all appropriate answers as well, and so we've met that specific criteria. It feels funny to be taped as well. So one thing we didn't talk about was his contour of his stomach. It's flat, it's not raised. For the most part, with the exception of our mom who's having a baby, the contour of everyone here in the lab area is going to be either flat or slightly rounded. Slightly rounded as well. So from there, and looking at making sure there's no protuberance, we talked through masses, lesions, and all of those things. I will be able to complete that whole entire section for inspection on my abdominal documentation and assessment. We would next move to
Check their facial expression and respirations and stuff too while you're doing this. I'm not sure that's mandatory, but if they have, if they're having facial expressions at any point throughout this, you would want to know.
And then the biggest part to remember is that in the abdominal assessment that you want to practice your, that you do your auscultation step before your palpation and your percussion, and not in that order, it's percussion and palpation. And so you guys can use whatever pattern you would like to auscultate. You just need to make sure that you place your stethoscope in all 4 quadrants. If for some reason you forget a quadrant, you can stop yourself and go, and you correct it, you can stop yourself and go back. You know, if you have forgotten a quadrant, I may say something to the effect of, have you completed your auscultation step? So if I say that to you, you've probably forgotten something. You don't want to press down on the abdomen firm during auscultation. You just want to gently place your stethoscope in all 4 quadrants. Jarvis, I believe, is going to tell you that you have to start in your lower right quadrant. I'm okay as long as you auscultate in all 4. What type of sound should I hear?
Gurgling.
Should it be high-pitched or low-pitched?
Low pitch.
If it's high-pitched, that's typically in what? Diarrhea.
Usually means diarrhea.
I caught myself also. During inspection, you'll also want to make sure that you inspect for any pulsations. So he has an aortic pulsation abdominally as well. So you make sure that in folks that are a little bit thinner. Do I need to talk up, or is this probably?
Make you fine.
Okay. So we've completed the inspection and auscultation steps there that you would want to know that you were able to auscultate all vowel sounds in all 4 quadrants in less than 5 minutes. And if it took greater than 5 minutes in each quadrant, you would consider the vowel sounds to be hypoactive. So you would say patient without hypoactive vowel sounds, auscultated, low pitch gurgling in all 4 quadrants, times 4 quadrants, something to that effect. God bless you. The other thing that you'll want to make sure that you do, and you'll want to make sure that you switch the side of your stethoscope. And so you'll use your bell, is we want to listen for bruits over 5 landmarks. And so you will originally start with your aortic area. And so if I'm listening for a bruit, I'm listening for swishing sounds. It would sound kind of like a blow, okay? I can't remember if we listened to a blow on Sin Man or not. This is aortic, renal arteries. And then down here, you'll listen for your iliac. And then for sake of privacy, you would just need to note to Bill or I that you would also auscultate in the femoral area so that no one has to be uncomfortable as someone auscultates in the groin area. But those are deeper down into the pelvis area, which is why we don't have folks do that. The other thing that you'll want to do, so all of the auscultation steps have been completed, and the thing that you'll note on your buoys is that you were unable to auscultate any swishing noted. So the other piece that you'll want to do is to percuss the abdomen throughout. To be in a systematic fashion, you'll want to start in your right lower quadrant and then come across the abdomen in